So the next question is, what are warning signs that I am not getting enough sleep? So, what are maybe signals from your body that are letting you know that your body needs more sleep than what you're currently getting? So one of them I think is pretty obvious is if you're still tired when you wake up in the morning, it's signaling that your body probably isn't done with the repair that it was hoping to do during the night. If you're having difficulty concentrating during the day, having like you're struggling to focus on your work or with your family, you're feeling kind of all over the place, having significant brain fog, poor memory, just struggling to remember simple things that you feel like you should, always losing your car keys or not remembering a word, having some mood swings, an irritability in your mood, like lack of patience, maybe a sense of impatience. For some people, again, they're going to have a diagnosis of a chronic health condition. I think that's a pretty good sign, maybe that they need some more sleep. Having those muscle aches and pains, like we talked about, because the body isn't repairing those muscles, poor digestion, bloating. I think all of those signs that, again, your body just isn't repairing optimally the way that it's supposed to during the night. Another question that I've gotten is what if what does it mean if I'm waking up in the middle of the night with my heart racing? So some people experience this symptom that maybe they're sleeping pretty soundly and then all of a sudden they're just wired, they can't go back to sleep, they're feeling that their heart is racing, having palpitations, really anxious maybe. And this could be from a number of things. So it's pretty hard to pinpoint exactly without testing, but here are some things that I commonly think about maybe when people experience this. One is maybe is there some like degree of sleep apnea or issue with the way that they're breathing because their body will then suddenly wake them up with a need to breathe, and also maybe their heart is racing because it's kind of activated a stress response. Number two is is it just a stress response of the body? Is there maybe elevated cortisol, some fluctuations in cortisol that are contributing? Because cortisol is kind of the body's primary stress hormone. And if there is a lot of stress in your life, then it may fluctuate up and down, even at night, and contribute to nighttime awakenings where your heart is racing. The other things that I think about are blood sugar. You don't have to have type 2 diabetes to have like swings in your blood sugar. And it doesn't have to be a really big dramatic swing either, like from 140 to 70 or something like that. It could be a very, like, still very normal range of blood sugar, but enough of a swing that your body is sensitive to that. And that can cause you to need to wake up, and it would then also activate possibly your stress response to send out more blood sugar to kind of soothe them. So that can sometimes contribute to a heart racing and feeling like you're waking up. The other things that I often see with my clients when I'm doing testing with them and they have this issue is that many of them have a high degree of toxic burden. So that might be environmental toxins like plastics or pesticides or things like that. Sometimes it's mold toxins because there are mold toxins that are kind of neurotoxic. And this then again can activate the body's stress response kind of randomly. um, and there are also like heavy metals that can interrupt sleep as well, and cause issues with sleep. So sometimes those are involved also. I would say the primary ones that I see though are usually mold toxins, and maybe other biotoxins associated with this. I also sometimes see this in individuals who are dealing with parasites in their gut potentially. And I've had a few clients who are maybe actively passing parasites where these symptoms then become even more prominent because of the maybe parasite die off and they're releasing some other toxins because they're in distress. And sometimes this might happen then if it is parasite related. Sometimes it's more likely around kind of the full moon. Like you might, if you pay attention to moon cycles, kind of notice that this gets more prominent around then. So those are some of the kind of big things that I might be thinking about or having people kind of look into a little bit more when they're dealing with that symptom in particular.